So the PROMs programme was set up to answer what is probably quite a straightforward question, which is that we should be measuring health not just by bad things that happen, whether that be mortality rates or MRSA. We should also be clearly asking the people who we're caring for whether their health has improved. So the basic premise behind PROMs is starting with the people who we're treating, we're looking after, and measuring in them whether their health has improved or not. And that's really the basic premise behind PROMs. There's lots more to it in terms of how that's been set up and how we do that and how we measure it and the extent to which we can get comparable data between different providers of care. But the basic premise is a relatively simple one. I work for NHS England, which was set up 2 years ago. So we've inherited the PROMs programme. So one of the things is that we're starting to really learn now what the benefits are of the PROMs programme and also about things that we might like to look at to see what we can improve. It's an extraordinary piece of work that's been set up, and it's the first health system of its kind to do this. And so the learnings from this, I think we can take to many, many countries. And being here in Australia, we can think about what have we learned from the UK PROMs programme. There are things to work on, but I think we can take lots and lots of very, very strong messages from what we've done. The next question is how can we roll out PROMs programs to other areas? So if it's in hip, knee, varicose vein and groin hernia, how can we start to do PROMs in some of the other areas like long-term conditions, which is a key area, to track patients' health, to make sure that we're understanding what's working, what's not working, that we're understanding where it works, but just as importantly, where it doesn't work. So the first thing they can learn is how they are doing relative to other providers of services, which is really important because it allows us to identify outliers. It allows us to identify outliers both who are doing better than the average, but also that are doing worse than the average. It can allow them to see what's working, what treatments that they're providing are working and what are not. What it can't necessarily always tell us is what you need to do to improve. And in some ways it isn't set up for that. But it gives you what could be best described as a tin opener of data, which allows you to start saying, well, what do we need to be looking at? So it's a great data collection that allows a hospital both to see what it's doing well, what it's not doing well, and what it needs to improve. So one of the possible criticisms of the PROMs programme is that it can be quite difficult for providers of services to interpret what it means. And I think one of the jobs for us to do now is to make it as easy as possible for people to interpret the data, to present the data back in a meaningful way, but also to say what can be done to improve so we can identify the problem. So the challenge with any measurement is it tells you what's working and what's not, but it doesn't always tell you what you need to do to improve. So I think what we need to be looking at in the NHS is strategies that allow a trust to not just measure, but actually to work on service improvement, to work on thinking, well, what have other trusts, what have other providers of services done with similar data? Why is someone doing so much better? Why is someone doing worse? Potentially starting to pair up different organisations to learn from each other to say what can we do to improve. So there has to be a clear programme, not just of measurement, but also of service improvement as well. So I think piloting is always really important, to make sure that you work through any problems, any glitches that could occur, to make sure you do it as well as you possibly can before you're rolling out more generally. The other thing that I think is worth pointing out is thinking exactly what the data is for. So when you're designing the collection, you're making sure that you understand exactly what that data can provide and perhaps importantly what the limitations are. Involving patients as much as possible in what's collected, making sure that we're measuring what matters to patients, what matters to users, and involving them in the process will add an extra dimension to a PROMs collection. So it doesn't just feel like a top-down collection that's been designed by academics for people, it feels as much that it's been designed around people. And then really thinking as much early on about both how you'll make sure that people listen to that data, educating people on what it's for, and allowing people to see not just what they can do with it, but also showing them what they can do to change any services based on it. So a huge education program to make sure that everyone's aware why it's being done, what they can get out of it, and what they should be thinking about when the results come in.